Good evening. This is the 2nd of May 2023. It's a session from Gloucestershire Carers Hub looking at relationships and intimacy as a carer. For the purpose of this presentation, we're talking about carers in the definition of somebody of any age who can provide support to a family member, partner, or friend who may need help because of frailty, physical or mental illness, or disability. It doesn't necessarily include somebody that's been paid or employed to carry out a role or someone who is a volunteer. So very importantly, this session is going to start to talk about intimacy in your caring role. And before you can consider any ideas for you and the person that you care for, you need to recognise that it's going to take time to start to feel comfortable with talking about sex, intimacy, being close, talking about your body and the person you care for's body. So being patient and taking small steps that might take months to feel comfortable, to be completely honest and upfront in regards to this. But it'll help you build up that confidence and to feel comfortable and find a way that you can be intimate and close with each other that you both enjoy. So very importantly, when it comes to the word intimate, it's finding out what it means to you first. So to take that moment to stop and think about what it actually means for you to feel intimate and close to somebody. Is it the physical aspect in regards to having a sexual relationship? Is it just touch and connection? Is it just having one-to-one time with the person that you are caring for, but isn't about the carer and cared for role? Once you understand what it means to you, you can start to have that conversation with the person that you care for, so you can understand your boundaries and then start to explore exactly what it means to them and exactly what their comfortable boundaries are as well. Making sure that you are honest with each other, that you, when in regards to connection, it's talking, it's touching, it's being really honest in regards to the emotions that you have about having that conversation, let alone actually taking it any further. It's okay to share that you're nervous. It's okay to go back to regressing to the first time that you may be connected with each other and those feelings that you had, because the likelihood is if you are feeling like that, then the person that you are caring for in your relationship outside your caring role is feeling exactly the same way too. In regards to sexual interest and libido, there's a number of things that might be affected because of physical, emotional, and mental health. So it's not just necessarily what you can see as physical restrictions as to why somebody may not be able to get an erection or feel like they want to have sex or to be able to enjoy sex. It's being mindful of not only the person's condition, the person that you're supporting, but actually yourself as well. So is there medication that you're on since the last time you were intimate with each other that may be affecting your libido and your ability to comfortably have an intimate relationship? And it's being aware of all of these things before you take it to the next step, because what you don't want to do is end up in a situation where you feel uncomfortable or you feel like it didn't go the way you wanted to plan in your head. And it ends up knocking your confidence for you to be able to take this or explore it again at another point. In regards to intimacy, like as we mentioned, it's not just the physical aspect of things. So taking the time to share your feelings, experiences, and emotions, taking the time to reflect back to maybe first experiences that you had together, moments that you shared even before they became the dynamics of a relationship changed. And even not just the good times, but the bad times, the difficult times, the emotions that you've overcome, the experiences that you've had together, and just giving yourself the opportunity to connect on that level as a couple, as a partnership, and not the dynamic of carer and cared for. But absolutely the most important thing to think about at this particular moment in time when you're first starting to explore the idea of becoming intimate, maybe again for the first time for a long time, is to talk and share those emotions and that honesty that you may have. Very importantly, if there has been a period of ill health and you're struggling to readjust to being a partner, you may potentially find that it's that sort of mental shift in regards to actually being slightly worried that you might not be in a situation, that you might be worried that you might hurt them. You might be worried that actually that at this present moment in time, because the dynamic of the relationship has changed so much, that you're concerned that actually that they might not feel comfortable having that relationship with you again. Very importantly, you might, because of the intensity of your caring role and how poorly that you've seen them, you might be seeing them as somebody that's quite fragile and vulnerable, and actually being able to let go of that moment and recognize that equal partnership in regards to intimacy is quite important to acknowledge that. It's having the confidence to let go of that caring role at that particular moment in time and rediscover yourself and the person that you're caring for, and vice versa. The person you're caring for, it's very important that they have the opportunity to rediscover you. So not putting the pressure on it being this particular moment on this particular day, and we're going to have a fireworks moment. It's all about taking it slowly, having those conversations and being honest with those emotions. Because if you've been through a really difficult time because of a period of illness, different treatments, the progression of a condition, things may have changed, and you may see each other as being a little bit more vulnerable. Or those physical changes may be that actually you feel to yourself that you might be putting them at risk of harm. And you need to be honest with the person that you are being intimate with, so you can start to build that confidence up together. Very importantly, it spins off from that is the fact that you or the person you may care for might be embarrassed because body image has changed since the last time you were intimate. So it could be that you've lost weight or gained weight through childbirth, or it may be through multiple health conditions and surgeries, that your physical appearance has considerably changed for multiple different reasons. And actually the last time you were intimate with each other, you may have been, a different weight, a different appearance. And you trying to be in a situation where you feel you need to be intimate to that level and to the way that you felt maybe 5 years ago or whenever it was, puts a lot of pressure on you to create a perfect moment. I'm going to put like a movie style moment. And actually the reality is you need to be honest with the fact that this is a real conversation with real people in real time, dealing with real experiences. And that's the true honesty and intimacy and that connection that you don't see when you watch movie or TV programs. So being aware of the fact that that might be one of the reasons or one of the barriers that you have to being able to let go is because of the appearance changes that you may have had. Or ultimately being honest if there are appearance changes in regards to the person that you're caring for. And again, going back to fearful that you might cause them harm, or you're worried that they might feel conscious. Talk, have that honest conversation and start opening that door to be able to have that true connection with each other. Talking about these worries prior to even planning any sort of level of intimacy or physical intimacy can help you to overcome those barriers, and you can start to relax because you've spoken about the elephant in the room, so to speak, and you're able to start to realize that there are moments that you're going to need to adjust, maybe adaptations that need to be made. Clothing might need to feel more comfortable. There are things, but you've actually accepted the fact that things have changed and you're growing older together and you're going through different periods in your life, but still remaining strong and still remaining connected. When it comes to the situation in regards to why things may be difficult, may feel uncomfortable, you may not be able to get an erection, sex might be uncomfortable or painful for a variety of different reasons. It's really important that you do reach out to the specialists that may be involved in you or the person you care for. Health needs. What you can see in front of you in this presentation is something called the Maslow's hierarchy of need. Health and social care professionals are trained against this, so they're very aware of this Maslow's hierarchy of needs. And one of the things that it actually looks at as being from a self-fulfillment to be a whole adult human being, that belonging and love needs recognises intimate relationships as being a psychological need. So when you approach a health professional in regards to why you're wanting to be intimate on issues that you may be having, or actually you haven't even explored having contact with each other yet and you wanted to make sure it's okay, it is absolutely normal and okay to speak to your healthcare professionals about it. They have been aware of this during their training. They are aware of the side effects of medication, surgeries, progressions of conditions, and they are absolutely key to making sure that you get the best out of these experiences to make sure you both feel comfortable. So once you've started to open those conversations with the person that you are caring for, so you start to have these intimate relationships and intimate contact with each other, connecting with your health and social care team to make them aware of this is a step that you're considering. It ensures that you are making sure that you are safe and comfortable, and those concerns that you may have in regards to harm or pain or discomfort have all been put to one side because you've actually got the right support and the right reassurance that you need. Ultimately, if you don't feel comfortable going along to a particular specialist, you can reach out and speak to your GP. You can speak to one of the practice nurses at the surgery. There are a number of forums that you can reach out to depending on what condition it is that the person you're supporting may have. There's numerous ways that you can explore finding out exactly what other people are experiencing and how they've overcome it. Very importantly, in regards to at any particular point where you're having not just physical contact, but emotional contact with somebody, those conversations that you're wanting to talk about when it comes to being intimate, it's making sure the person has given consent and understands and agrees that they want to be part of these conversations. So it's going right back to actually wanting to talk about it. Are you happy to have these conversations if it's been initiated by the person that you are supporting? Or are they happy to have these conversations? And as long as you have consent, which is the capacity to whether someone can make their own decisions about something, consent to whether someone has capacity to decide if they freely agrees to do it. And very importantly, they must consent to any sexual activity before the sexual activity starts and must continue throughout. Everyone has the right to say no, stop, I don't want to, whatever variation that comes out in. But at any particular point that this conversation or this act or activity is too much for somebody and they ask to stop, that is absolutely the point that you stop at. And vice versa. If you're not comfortable and do not want to continue and you say stop or no, then very much you have withdrawn your consent to that activity and it should stop. Very much when it comes to any particular point in regards to any activity that you undertake or any conversation that you have, consent needs to be asked for every single time. So it's not just a one-off at the beginning of having these open conversations with somebody. You need to be ensuring that you're asking this every single time, and very much you're happy and feel, understand and agree with the content of the conversations or the activities that you wish to undertake. So in regards to sex and the physical activities in regards to it, if you're starting afresh after a number of years and you're not sure whether or what to start, approach the conversations, how it might feel, how things have changed over the years as well, because there's been huge advancements in regards to the types of support that are out there, equipment, lubrication, protection, etc. If you have a search of the Durex website, the Durex website isn't just all about condoms. It talks about how to use lubrication. It talks about medication and certain conditions that can cause vaginal dryness. It goes through how to explore your body and the person you're caring for, different activities that you can undertake together or on your own. And very importantly, things like when we talk about exploring your own body, it's actually getting comfortable with recognizing how to masturbate comfortably, what an orgasm feels like, It gives you a chance to explore different sexual equipment that might be available. If you're starting to use condoms again, what different condoms are out there and what works better in particular situations? Because it's being mindful of things like, as time has progressed, there are certain lubrications that you may have to use because of vaginal dryness, and they aren't potentially compatible with certain types of condoms. So it's just being mindful of that. In regards to experimenting with ideas, so again, intimacy doesn't have to start with having physical sex. To get comfortable with the fact that you are starting to be close to each other as a couple, as an equal dynamic, so putting the carer and cared for relationship to one side, you can start to explore different ideas. Some of the suggestions are things like reading an erotic story to each other, cuddling up next to each other with or without clothes on. So I mean that sort of mindfulness, being where your hands and fingers go, the touch of skin, the smell of the skin, the smell of hair, the way that your skin feels against each other. It doesn't necessarily mean that you have to take it any further than just physical contact. You could go to bed and watch a film together and just sit cuddled up next to each other and watch a movie, even if you don't share a bed with each other anymore. But having that closeness and that connection together, again, shifting the dynamic from being cared and cared for to actually being a partnership. If you're finding that you aren't able to physically have sex, or you want to explore for a variety of any reasons that feel comfortable for you using sex toys and equipment, there's a number of different places out there you can start to explore what's out there and what you can use. Because very importantly, different conditions can affect sensitivity. So you may find that actually having penetrative sex doesn't bring you to orgasm. So you might need to look at different things that you can use that will actually give you that fulfillment. Or very importantly, the person you're caring for, that allow them to reach orgasm. So again, the Durex website has numerous articles in regards to it. There's a website called Fumble, which you can have a little look on, and it talks about different types of toys and equipment that you can use, different sensitivities, and you can explore it from that perspective. And then ultimately, if you want to start looking for different types of equipment, there are numerous websites out there you can go and explore, or you can go into shops and ask for advice. They are trained advisors in their specialists. Gone are the days of having the little blacked out shops where that are hidden in the corner of high streets. You can have a little look now in places like Ann Summers and get advice and get information that means that you're actually getting equipment that you feel comfortable using, setting up, keeping clean, and for a variety of different reasons you can kind of go back to them to actually ask them for ongoing support to make sure it is a comfortable experience for you. So separate key hints and tips in regards to this, as we mentioned before. It's separating that you're a partnership, you're a couple, and you're not at these particular moments in time carer and cared for. So what is suggested in regards to advice from numerous carers organisations and forums is ensuring that that couple time doesn't become entwined with being a carer. So do not make this moment directly after helping in regards to personal care or hoisting somebody into bed or following a hospital appointment. It's dedicating that time. Now, we love spontaneity, but you need to be mindful of the fact that with all there is planning involved to make sure that you can feel like a couple and not like carer and cared for. So there is an element of planning that needs to be done for this, and dedicating that time away from the carer and cared for role. Changing that routine to allow for intimacy. So if you help with washing and bathing from a practical element, or you help somebody go to the toilet, you need to be able to separate the caring role. So in regards to washing and bathing, is there a time in the day where you could actually make one day that week a sensual moment? So they change the lighting, the music, you slow down the routine, you're dressed differently, maybe use different scents in the bathtub, maybe candlelight, but making sure that the actual physical aspect of the care that you are providing has completely shifted. And now that moment is a sensual, caring moment with each other. It's not about the practical aspect of getting clean. Thinking about how touch feels for both of you, so talk. So it may never go past the actual having a bath together or sharing that moment, but talking about the sensation in regards to touching each other's skin, the warmth, the opportunity to, going back to reading a story or watching TV together, synchronizing your breathing and feeling that closeness of each other, but share that experience so that each other know how much you are enjoying each other. Make it clear that when you are starting to plan and have these moments, that it is because you're there as a couple. So putting your arm around each other and watching TV isn't to keep them safe so they don't fall out of bed. It's because you want to feel close to the person that you're in a partnership with. When we talk about trying different locations, if you have specific rooms that you both sleep in at night, can you change the dynamic so it doesn't become part of that day-to-day routine? So is there a different room that you can possibly go in to be intimate that can have the lighting, the warmth, the candlelight if necessary, can have different music, different bed sheets so they're not the clinical ones that you have to whip off every single day? Explore maybe even going away and having a night away so it does feel like it's a relationship and a date night, more so than it is a care and cared for relationship. But talking and exploring what might work for you both is really key. So it isn't a case of one person driving this conversation forward. All the way through, it's about getting that equal partnership, equal conversation, and both of you consenting and agreeing to the next step before it is planned. It's important to talk about the adjustments that may need to be made. So it might feel a little strange at first. So there might be things you need to consider in regards to continence issues, catheters, spasms that may be caused by certain conditions, mobility changes, which means it's not so easy to move. But actually part of that planning, talking and feeling comfortable with the fact that you've explored that these adaptations need to be made and things are going to be a little bit different, means that somebody doesn't feel like they're letting the other person down. So it isn't that, like I said, that movie moment and that's what they're expecting. That you're allowing yourself to make those adjustments, making that effort for each other and talking openly throughout is part of being intimate. It's part of that closeness. And as we highlighted here, not to get caught up in making that moment perfect. If it doesn't go to plan, think positive. At least you've started to go in the right direction. You've opened that door. You've started to have that conversation. You've started to explore being a partnership again. Other things to consider, as we sort of briefly mentioned at the beginning, is in regards to menopause. So female hormones decrease. However, women have testosterone, which drives libido. And as women reach menopause, testosterone levels also drop. So as we highlighted in regards to certain things that can happen, such as vaginal dryness, if you start to use lubrication and when you're exploring masturbation to explore your own body, or again, part of that sexual act of being with each other, it's looking at what lubrications are out there, making sure that you feel comfortable using them, how to use them, if you're going to use toys or condoms, making sure that they don't interact with each other so they stay safe and in usable condition. If you're exploring a new partner or you've had recent partners that are different from each other and you've never gone through so maybe having tests in regards to sexually transmitted disease, it's absolutely key to remember that even if you've reached menopause, you're still at risk of sexually transmitted disease and pregnancy until you've had confirmed and full menopause. So if you're having sex with a number of people, ensuring that you are using condoms every time, again, going back to the lubrication that you might be using or the toys you might be using, making sure that they are cleaned as per the instructions or the manufacturer's instructions, if it's a toy, and the condoms are compatible with the lubrication that you use. And reach out to your GP. in order to get regular checkups. You don't have to go to particular clinics unless you want to. You can explore ones that are near you via websites, and you can go onto your own web pages and check the sort of incognito tab on your mobile phones and so the privacy apps on your computers if you don't want people to trace the history if you're searching. But going to your GP, it is confidential information, and they can advise you appropriately and safely as well. If you think you may have contracted an STI, you can, I said, very important, you go and see your GP. And there is some information on the STI public information from the British Association for Sexual Health and HIV. And there's lots of different information in regards to different STIs, what they look like, how they're treated, including how to use condoms. Because again, things have changed considerably, literally year by year. And what may have been a French letter a few years ago and the technique to put it on and the durability they are far more fragile in regards to how you put them on now. And it's just practicing those things. Both Durex and the British Association for Sexual Health and HIV not only have public information, but there are videos that you can look at that can help you actually start to practice the application of using condoms. And that's not just for men to practice this. This is for women to get comfortable using condoms, to ensure that they feel comfortable as well, because there are female condoms out there. You may want to go down the route of using male condoms and actually feeling comfortable that you know it's fitted properly and that you're able to do so yourself. Hope House in Gloucester and Cheltenham also provides support in regards to STIs and pregnancy, and they don't have, and very importantly, any of the information that you share with Hope House. They are the patient records of Hope House, and nobody else apart from the staff working in their clinics has access to that information, and that includes your GP. Importantly, in regards to age, so men can also experience a lower libido as their testosterone levels decrease. Certain medications, such as medication to treat prostate issues, can affect sexual drive, which is why it's important to explore this with your GP as part of that open conversation. That if you're on medication to address one issue, it's highlighting actually that you have a relationship that you want, even if it's not an active relationship, but it's something you want in maybe in the future, or you want to keep it as sort of that open door, that to have that conversation with your GP that you do want to be active, do want to be able to feel comfortable having sex, do still want to be able to orgasm and have erections, and making sure that they're aware of that. So as part of the medication planning and the treatment that you're on, they are considering the medication that's going to have the least impact in regards to it. So again, in regards to STIs, they can even be passed on during oral sex. Go onto the Durex website, have a good old explore of all the information that's on there, the videos that they have there, and the guidance, just so you feel comfortable with making sure that you're keeping yourself protected. So in regards to videos, if you don't want to start having a little look around, on the presentation in front of you, there are some video guides for you in regards to how to fit a female condom, what they look like, what they should feel like, and the step-by-step guide in regards to how you put them on. And it's the same for male condoms as well. So it's just to get you, before you even explore being intimate, getting comfortable with protecting yourself and looking after yourself and getting to know your body again is absolutely crucial in regards to not only your confidence, but the comfort in regards to intimacy. So if you're considering using a service for intimacy, so sex work can be prostitution, stripping, lap dancing, performing in pornography, phone or internet sex. It can be any sexual service in return for money, goods, or other agreed items. So in regards to the law in this country, the exchange of sexual services for money is legal in the UK. However, there are certain offences that are under the Sexual Offences Act of 2003. So from a soliciting, trying to get a sex worker on the street or a public place, and that includes getting somebody into a vehicle, or paying for services of a sex worker who is forced or threatened into it. So it's just being mindful in regards to the legality of using a sex worker. If you are considering using an escort agency, there are some simple advice that has been written by the London Post. So if you're going to go down the route of using a professional service for a sexual encounter or from an intimacy perspective, making sure that you're hiring an escort from a reputable agency and using reliable directories. Making sure for your safety that you're in control of your well-being. So you limit your alcohol intake, you know where you are, you keep yourself orientated and safe. You do not leave your own food and drinks unattended to reduce the risks of those being spiked. You choose a venue that you consider secure, so you don't get taken to places that you aren't aware of, you don't know, or places or hotels that you weren't planning to go to. Make sure that you keep yourself safe the entire time. And following your gut instinct, if it doesn't feel right and you don't feel comfortable, as we explored right at the very beginning in regards to consent, it's not just consent of the person that you're having an intimate relationship with, it is your consent. And if you don't feel right and it's a no, and you get out of there and you keep yourself safe. That's the end of this very brief presentation. It just is an overview. We're very happy to send a copy of this presentation so you have the links to the information that is on here. So the videos such as about putting condoms on, the Durex links, Fumble, etc. So it gives you a chance to explore in privacy of your own mind. This YouTube video doesn't go onto your records either. So if you request a copy of it, you can watch it in your own time and go back to it to sort of refer from notes and perspective. However, if you do want any further advice from Gloucestershire Carers Hub, it is strictly confidential and you can talk one-to-one with a member of our triage team. And our telephone number is 0300 111 9000. You're able to have conversations with our colleagues, are completely honest and confidential, to ensure that you feel comfortable with any steps that you may wish to take in the future. Thank you.